34 degrees now at KNEB, and time for News Extra, brought to you by Gering Civic Center. Here's Kevin Mooney.
Thank you, Dennis. Good morning, everyone. We have Debbie Jelinek here. She is an occupational therapist with Regional West, and she came down all the way from Alliance to talk to us today about something that's called lymphedema. That's one of the things, that's the thing she treats. How you doing?
I'm doing great, thank you.
Good. So you had to get up at what time to make it down here from Alliance?
5 o'clock.
5 o'clock this morning. She's a trooper. She was down here right at 7 o'clock. Tell us about lymphedema and what that is.
Well, lymphedema is a swelling that's different from regular edema because it's got a protein in the fluid. So it's basically just an abnormal accumulation of fluid in the body that just is chronic and does not go away, unfortunately.
And what result does this have for the body once all this happens?
Well, we see a lot of people that can become pretty debilitated from it, and have told me stories of they were thinking they had to quit their job or could hardly walk anymore, and so it can become pretty serious.
Okay, swelling in the arms or legs, basically.
Yeah, it can be in any part of the body, though. Also.
All right, and painful.
It can be very painful, especially, in any area because, when you really swell up, that skin is really on a stretch, and a lot of the times it becomes painful and it really can lead to chronic infection, too.
So how many folks do you see from around here on this?
Fortunately, we have a very good relationship with the Breast Cancer Center, so I see a lot of women that have lymphedema issues post-mastectomy, and I see them even prior to surgery just to make sure that we take very good care of them.
And then it's also kind of a genetic thing, right?
It can be genetic, yeah. It also can be, it's somewhat related to people that have some chronic vein issues, so a lot of the times we'll see those people with the leg swelling also.
All right. So we'll talk more about this particular disease right after this.
Having food that is consistently great is something worth talking about. Great food makes a great event. That's why the Gering Civic Center goes the extra mile to serve great meals at every event we host. Along with the caterers, the meat shop, we are a great partnership, hosting events for over 23 years in our elegant, column-free ballroom while never charging room rental if food is purchased. Visit GeringCivicCenter.com or call 436-6888.
Back on News Extra this morning, Debbie Jelinek is here from Regional West Medical Center, and we're talking about lymphedema, which is a swelling in your arms or legs or really any part of your body that apparently many people have here in our particular region. It's genetic. It possibly you can have it due to cancer or cancer treatment, or maybe you have a family thing, right, that causes this, and any age, right?
Any age, yeah. We've seen my youngest person has been even less than 2, and of course into the geriatric ages too.
All right. So what do you do in order to try to offset this?
Well, basically this sort of condition takes a lot of training. I've been put through a lot of training courtesy of Regional West, over 200 hours just in this subject. And so we treat it very well. Normally it involves wrapping the limb to try and get it the most small, optimal size that you can. There's also a massage that works very well with it. And then we try and help people with permanent compression that they can manage and that manages their size and their pain and a lot of other things.
All right. Does this require more than one visit? Probably, right?
It definitely does, yes. Yeah.
Most people, are they regular visits for a week or a month or something like that?
Yeah, normally we see the person anywhere from 2 to 3 times a week for several weeks, just again trying to get that limb size down, pain more manageable. And then I definitely encourage treating family members and seeing them and training them in the massage and the wrapping. And then also then we work with the equipment companies in town trying to make sure they get the right compression devices ordered.
And are there prescriptions that maybe are given to people for this?
Yep. Basically, the referral comes normally from their primary physician, and then we take it from there over at the rehab center.
How many times is it severe enough where if you do your stuff and then maybe you have to send the person to like another facility somewhere else?
Normally, we never have to do that. Again, we're very specially trained over there. We know what to do with it, and that has never been an issue.
Okay. So let me I don't know whether you can give me an idea. How many people do you see for this in a week's time?
You know, it really varies. Again, we've got that great relationship with the Cancer Treatment Center over at Regional West, so we see a lot of women, even pre-mastectomy, for a lot of training and education. So it just varies. Normally, it's at least several people a week.
Okay. Phone number or email, or how they can get a hold of you?
Yep, they can definitely get a hold of me over at the Rehab Center at Regional West, and that number is 308-630-1355, and we'd be very happy to take care of you.
All right, very good. Well, Debbie, thank you.
Thank you.
Pretty enlightening stuff in regards to lymphedema. If you have this problem, make sure you give Debbie a call. Again, 630-1355. Thanks for coming in.
Thank you.
Appreciate it.